Good morning. My name is Jim Dice. I'm one of the registered nurses here at Twin Oaks Home Care. And welcome to the mandatory spring staff meeting, April 13th, 2010. First on the agenda is our policy review. And there's been a couple things since I've had the agenda printed up that have come up that I need to bring to your attention. It's not actually on the agenda. The first thing is the pillboxes in patients' homes. Everyone knows we are not permitted to fill pillboxes in patients' homes. We've had a couple situations where the family members haven't been doing it and left it, and an employee went ahead and did it. I just need you to know that that's not our policy. Our policy is the families or the registered nurses must do it. An employee can do it, but they have to be shown by a registered nurse. They have to be signed off on how to do it. I don't prefer that. I just want you all to know that. I would say out of 100 patients, 99 of them, the registered nurse and families are filling pillboxes, not us. Because there's other options. There's also the bubble packs that the pharmacies can pre-fill. All of their medicines at 9 a.m. that they're to take are all in one little pack. All you have to do is open the pack. That way, my employees aren't getting into pill bottles, taking out certain things, because if something gets missed, or if something gets added that shouldn't be there, there are people's lives that are at stake. So it's something that I really don't want us to be doing. Next is the two-step TB. There's been a lot of confusion about that with our recent licensure. The state has said that there must be a two-step TB done. Up until this time, it's only been a one-step. But to clarify that, the two-step TB only has to be done if it was never done before when an employee is first hired. Once a person has the two-step TB, or they have negative results from one-step TBs, annually you only have to get a one-step, which means I only have to interrupt your life for one day instead of you coming back a week later or 2 weeks later to get a second TB. So that's really good news. TB steps annually are just a one step, as long as it was previously negative. And the third thing that's not on here is the break times. Some employees had some questions about break times. We abide by the state law for all workers. Break times, if you're scheduled a shift that is 4 hours, you get a 15-minute break. If it's less than 4 hours, you get no break. So if you're in a shift for 1 or 2 hours, it's not guaranteed. And that's not my law, that's the state law. If you're scheduled a shift anywhere between 4 and up to 8 hours, it's 15 minutes. If you're scheduled an 8-hour shift, it's a 30-minute. You can break that up however you'd like to. What we ask is that you make sure that the patient is safe before you take your break. Also, if you're going to take a break, if you're going to go outside, if you're a smoker, make sure you take a container with you to put your cigarette butts in. Don't flick them out in the patient's yards, because we've got complaints years ago about families coming home and their cigarette butts in the yard. So our policy is, yes, you're allowed to take a break. If you're scheduled 4 hours, it's 15. If you're scheduled 8 hours, it's 30. Make sure the patient's safe. And if you are a smoker, when you go outside to smoke, because we're not allowed to smoke in patients' homes, maybe stay in a position where you could still see in to make sure that the patient is safe during your break outside. Doesn't mean you have to be inside, but in some situations you can stand outside, there's a screen door with a glass in it, you can look through. Okay, now to the agenda. A, call-offs. Call-offs really aren't a huge issue. We have 90 employees, everyone's allowed 2 unexcused absences, not including all of the excused absences. But the problem that we're having is that the employees are not getting the slips in from the doctors, from the funeral home, from their kid's pediatrician, from their auto mechanic. I mean, if your car's broke down, I have to have something in writing here. That's what protects our company, and that's actually protecting you. So I can't do it for you. You have 3 business days. If you call off on a Friday, you have Monday, Tuesday, Wednesday to get a slip into the office. You don't have to bring it in yourself. You can actually drop it in the mail. If it's something you need a copy of, copy it before you mail it. If you bring it in here, we have a copy machine. We can copy it for you. So the important thing is we have to have that documentation on your file. And that is what excuses you from the absence. So that way you won't fall into the disciplinary process. Okay. B, driving the patient's vehicles. There is a hired non-owned auto insurance that our company possesses. But in order for our insurance to cover you, if you're going to be driving a patient in one of your vehicles, your limits have to be at a certain set rate. If your limits are not at that rate, then you're not permitted to transport patients. Okay? The office assistants will be checking with you on insurances. If you're going to be transporting patients, you have to provide us with the face sheet of your insurance. It just shows that you have insurance, who it's from, and what your limits are. Plain and simple. C, notes in the patient's homes. Now, many of you go into a home that we're in, several times a week. Well, you might be there might be a problem. You may need to leave a note for the next person coming. You're not scheduled there the next day. You are permitted to leave a note, but you have to call the office and say, I'm going to be leaving a note in this patient's home. We have to be aware of any note that's left in the home. That's policy. Several years ago, probably 8 years ago, before we had this policy, girls would write notes and write bad things about other girls that were there the shift before them. Well, that's not how we function. If there's a problem with another employee, you pick up the phone, you call the office, we'll handle it here. I don't want you taking that responsibility on. Okay, D, time signing in and out. Of course, we cover this every time we get together. Our times must be accurate. If you're there at 10:15, you mark 10:15, you don't mark 10 a.m. If you were scheduled at 10 a.m., you have to call the office to let them know, because we have the master schedule in here that has to have accurate times. If you mark 10 a.m. and you got there at 10:15, that's, depending upon the payer, that's fraud. And when they come in to verify times, and they talk to patients and families, and they do that, they could actually press charges against employees or against companies that are not meeting the expectations of the policies that they give us. So it's very important that they are accurate. Also, there's been some mistakes that have been made on documentation. If a mistake is made, you put one line through it, you put your initials beside it, and then you put your correction. If you forget to complete a whole box, I just want you to be aware, we're in there, whatever shift you're in there, you have to check mark what all was done during that shift. Make sure that you complete that before you leave, because we've been getting some daily forms in where those aren't completed. The employee has to be called and notified they have to come into the office here, and then they have to complete it at a later date. We don't want that. We want it to be completed before you leave your shift. Also, don't mark down anything that you didn't do as if you did it. That's not accurate. If you check mark that you ran the sweeper that day and you didn't run the sweeper, the families are looking at those things, and they have every right to. And they will notify us if that occurs. So I just want you to know, be accurate, don't forget, and if you make a mistake, it's okay. Just one line through it, and then correct it. Make sure your initials are beside it. As far as call-offs go, E, there is an 8-hour notice that we are required, and that allows us to stay dependable. It allows us to find another employee to get to the patient's house, and it allows us to not pull all of our hair out, because it's a very stressful situation if someone calls off 30 minutes before their shift. Well, there's no way we're going to be able to get someone there on time. So when there is a call off, make sure that you abide by the 8-hour policy. It's 10 o'clock at night and you're not feeling well. Chances are you're not going to feel well tomorrow morning. Go ahead and give us the 8 hours that we need to get someone else to cover that shift. And for those of you that are here that have been called and have been asked to help cover a shift, we just want to say thank you. Because it is important. And the patients and the families are depending on us in being there. Hopefully you've gotten a card in the mail whenever you've done that. Some of our office staff, they'll send a card out and say thank you for coming in on your day off. We do appreciate that. F, under incident reporting, this is something that's part of the mandatory information. You need to be aware of what employee-patient incidents are, and there's a difference between an incident and an injury. An employee-patient incident is a no-show, being late, poor job knowledge, left early, watches too much TV, sleeping on the job, failure to follow policies, client intimidation, inappropriate behavior, verbal abuse, argumentative, neglect, sexual harassment, assault, alcohol use, drug use, drinking or smoking on the job, personality conflicts, forgery, theft, property damage, fire, patient safety issues, and an injury to either the patient or the employee. And then it breaks down employee or patient injuries, which would include animal bites or stings, self-inflicted injuries, lacerations, a fall, a burn, an abrasion, a puncture wound, a back injury, an injury where there's a bone that's broken, a sprain or a strain, an accidental injury, a suicide attempt, a needle stick, pressure sore, a motor vehicle accident, and any allergic reactions that are noted in a patient's home. Anything that I mentioned there must be called into the office. And if you're not sure, call the office anyway. I'd rather you be on the safe side and call too much than to miss a problem and to not call. The third one there under F says that once an incident is reported, the supervisor will document it in full on the employee complaint policy infringement report sheet, which we have here. It's an incident report sheet. If additional documentation is needed, the employee in direct contact with the incident will also document it as well. So you may be asked to come in and to fill out a paper as to, okay, be subjective, this is what happened. And then number 4, once an incident is documented, the supervisor here at the office will notify the appropriate people, such as a physician, maybe the patient's family. They can notify us, the owners, or even the care manager at the state, or anyone else that needs notified. Pharmacies, skilled nursing agencies. This notification will also be documented as well. That way when people come in and they do our audits and there was a problem, they can see, yes, the employee saw the problem, they did the right thing, they called the office documented it, the office did the right thing, they let the people know that needed to know, and the problem was resolved. Or it wasn't resolved, and this is why. Not all problems are solvable, but we do try our best. Okay, number 2. Home care safety. This is probably the hugest section that we've been dealing with over the past 2 years. I decided to hand out the Pennsylvania Emergency Preparedness Guide. If you don't have one, make sure that you get one off of one of the office assistants. I'm not going to go through the whole thing because there's a lot in there. We hand this out to all patients and families on admission. What you need to know is that you should have, not just patients and families, but employees as well. You should have at least 3 days worth of supplies in your home for every person. Medications, food, water, the basics, essentials. Okay? Those would cover severe weather emergencies, earthquakes, floods, and around here we do get snow emergencies. So it's very important for you. This is your copy to keep. Anyone that watches the DVD will also get a copy. Okay, next, B, fire safety, client and employee. When you're in the patient's homes, we do send supervisors out. We have a safety committee that goes out. We do a home safety checklist. They're looking for fire extinguishers. They're looking for smoke detectors. Anytime you're in a patient's home and you see a smoke detector, we should be testing those once a month. And I would ask every employee to do that. If there's a fire extinguisher sitting there, all fire extinguishers have a gauge. Just take a look at it. It should be in the green. If the pressure drops down into the red, call the office, let us know. We can get a hold of their family, and we can let their family know they can get another one. Or we have actually purchased fire extinguishers for patients' homes. Because I don't want my employee to be in a home, to have a problem, to have a fire. If there's a fire extinguisher there, 90% of the time, it can be extinguished with very little or no damage to a patient's residence. Instead of, if there's not one there, the chances are 90% the whole house is going to burn down. So, fire safety. If you notice anything in the home that has like electrical frays or sparks, or you're looking at bare cords on appliances, definitely call the office. Let us know. We will look into that. C, personnel and client safety. This is one of the mandatory sections that we need to go ahead and talk about at this time. Number 1, on assignments where personnel have the risk of an occupational exposure, the organization will furnish at no cost to you, to the worker, appropriate personal protective equipment, otherwise known as PPE, personal protective equipment, so that barrier precautions can be observed and compliance with this policy can be maintained. Personal protective equipment may include, but is not limited to, gloves, disposable gowns, face shields or masks, and eye protection. Number 2, all personnel will use appropriate personal protective equipment when there is a potential exposure to blood or other potentially infectious materials. Number 3, Twin Oaks Home Care has the right to limit the practice of the worker if the client's safety is in question, which means the patient isn't the one that's sick, you're the one that's sick. If I have an employee with pink eye, I'm not going to send them into a patient's house. Pink eye is highly contagious. You're going to give it to the patient or to their family members. Number 4, the following exposures by personnel will be immediately reported to the supervisor for appropriate follow-up. If you're in a home and you have a cut, an abrasion, or a wound obtained during client contact. Or B, a splash by any blood or body fluids on mucous membranes, cuts, open lesions, or skin rashes. So that's very important that you understand. If you're in a home and you come in contact with any blood or body fluid, that must be reported to the office immediately. We do everything we can to limit employee exposure to those incidents, but it doesn't eliminate them completely. It can still happen. Number 5, employers shall ensure that employees wash hands and any other skin with soap and water, or flush mucous membranes with water immediately or as soon as feasible following contact of such body areas with blood or potentially infectious material. See attached protective device checklist. If you do come in contact with any of that blood or body fluids, it must be flushed immediately or washed immediately. On the protective device checklist, it goes over the activities that you could be performing and the protective devices that you need to be using at that time. For example, a routine bath, which is 3/4 of the way down the page, hand washing, and gloves, which is S, which means if soiling is likely. If a patient's entire body skin is intact and they're not incontinent, you don't have to wear gloves when you're bathing them. If they have cuts or wounds on them and they're not continent, and you've got to be changing diapers, then yes, you better have gloves on. Okay? On the agenda, page 2, at the top, number 6. Contaminated needles and other contaminated sharps shall not be bent, recapped, or removed. Shearing or breaking of contaminated needles is also prohibited. We don't want anyone getting stuck with a needle in a patient's home. And make sure that if the patient's using needles, that they're putting them in the appropriate container. It should be a plastic container that is hard plastic that has a screw-on lid. Not a coffee can with a pop-on top, because that can pop off and then the garbage man can get stuck. Number 7, eating, drinking, and smoking or applying cosmetics or lip balm and handling contact lenses are prohibited in your work area when there is a reasonable likelihood of an occupational exposure of contact with blood or body fluids. They don't want you doing those things because if you think about it, those are areas where your mucous membranes are located, and an infection can be transmitted during those activities. Number 8, all procedures involving blood or other potentially infectious materials shall be performed in such a manner as to minimize splashing, spraying, spattering, and generation of droplets of those substances. And number 9 is our hand washing policy, which is the second part of the attached. And the purpose is to clean the hands and germs, prevent contamination between client and personnel. Our policy: personnel with direct contact will wash their hands upon arriving for work, before and after contact with each client, after handling contaminated items such as a bedpan, a urinal, a catheter, or linens that have been contaminated. Next is before and after gloves are used, before and after eating, after use of toileting, after you blow your nose, sneeze, cough, or touch your face, and then when you leave work, because you don't want to take anything home with you. The rest of the policies there for you to review. It's policy number 5-042.1 and 5-042.2. Next section on the agenda is section D. Talks about the principles of body mechanics. We do go over this on orientation. We also go over this during the home health aide certification class. But I thought, these 7 things I want to refresh your memory on. We've done very well over the past 2 years in limiting injuries by using proper body mechanics. And we've done a couple other things as well to help limit those injuries. But these 7 things I want to bring back to your attention. Number 1, if you do have to carry a heavy object in a patient's home, carry it close to you. Don't carry it farther away from you. That's going to increase the strain on your back. Number 2, try to stand erect as possible when you're performing your job. Number 3, if you have to bend over to pick something up off the floor, bend your knees. Don't keep your knees straight and bend your back. Number 4, avoid lifting something from the floor. If you're taking clothes out of a dryer, bring a chair over, put the laundry basket on the chair, and then fill the laundry basket. Don't put the laundry basket all the way on the floor. Number 5, push near the center. It's enough said on that one. Number 6, keep your shoulders up. That's also going to reduce and eliminate the strain that's on your back. If you're sitting forward or leaning forward all the time, that's going to put more strain on your back. And number 7, I added this one, pull from the head of the bed. If you're going to be helping a patient up in bed, if they're, they've slid down, you want to make sure that the bed is away from the wall, the head of it, and go around the head of the bed, elevate the feet, put the head in the low position, use a draw sheet, and you want to pull the patient towards you, and you're actually pulling them downhill. Gravity is going to assist. I had an employee 2 months ago that decided to stand near the top of the bed and try to pull sideways. And when they did, they got a muscle strain in their rib cage. All that could have been prevented if they would have followed the proper body mechanics and techniques, and that's how we teach it. We teach that in orientation. We also teach that in the home health aid certification class. Put the head down, put the feet up, get at the top of the bed, and pull them down heel towards you. If the patient can bend their legs and help you, that's great. If they have an over-the-head trapeze bar and help you, that's great too. Section E on the agenda, hazardous waste. You also have an attached housekeeping checklist and how to handle hazardous waste. Let's look at the definition here first on the agenda. It says, hazardous waste is chemicals and materials that may cause or contribute to serious health effects, present a safety hazard, or have a potential to cause a fire, an explosion, or a serious accident. Now, we normally don't handle anything that's hazardous, but being in a home, you could come across something. You never know what you're going to come across in the patient's homes. So it's a good idea for you to have just a basic knowledge of what could be hazardous and how do you handle it appropriately. The housekeeping checklist. Personnel will be made aware of the following housekeeping requirements. The OSHA, which is Occupational Safety and Health Administration, standard on bloodborne pathogens. And just to read the headings, you can read everything underneath. The decontamination of surfaces, how do you do that? There's the steps. And when do you do it? Protective covering of equipment and environmental surfaces. How do you decontaminate equipment and when? How do you decontaminate receptacles? Cleanup, just regular cleanup of something like a broken glass, something that could be or may be contaminated. Maybe a reusable item that needs to be contaminated. How to handle infectious waste. And how to handle laundry that may be contaminated with blood or potentially infectious material. Okay, number 3, calling the office. If you, we go over this again. If you call the office, you only need to call one number, and that's the 438-1936. If it's long distance, you call the 1-866-566-9214, because all of the phone numbers that we have here at the office, they all ring in on the same line. And if you are local, don't use the toll-free number, because we actually will have to pay for that. So if you're in Uniontown and you're calling Uniontown, don't dial the 1-866 number. Call the 438 number. Number 4, tax collection. We will be withholding local tax